The Able to Care podcast is sponsored by Able Training Support Limited, who build partnerships with organisations to develop confidence and competence in their team to promote positive outcomes for all. Find the link in the description. Hello and welcome to the Able to Care podcast. I'm your host, Andy Baker, and joining me today is Kate Thubron. I can't pronounce your name, so it's Thubron.
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 Yeah.
So Kate is trained as an occupational therapist at University of East Anglia between 2005 and 2008 and gained experience working in Norfolk, Suffolk, Essex and also overseas in Mombasa, Kenya, which is fascinating. Throughout this time, Kate found a love and a passion to support people living with dementia, their care partners and families. And after taking further qualifications in dementia care, she started working at a larger care home company as their dementia care lead. So you oversaw 37 different homes and leading a team of over 70 dementia coaches as well, which sounds challenging at the best. And you were leading all aspects of dementia care within that organisation. And Kate has been recognised at national level and winning the best national dementia lead in 2018. You've also trained with Teepa Snow. So some people listening may have heard of mentioned Teepa Snow before because we're all a bit fan favourites of hers. So we geek out on that. So we'll have a chat about her as well, if that's okay. Kate is a dementia expert who is one of the few positive approaches to care trainers in Europe, which is Teepa Snow's system. Kate loves practicing and studying mindfulness and meditation, which also you've added into your training and the works that you do. So thank you so much for joining me this morning, Kate. It's a pleasure to see you.
Thank you for having me. It's great to be here. Thank you.
And I know you've rushed around getting kids sorted, getting people sorted to come on this, and you've got a busy day ahead. So I do really appreciate and value your time for coming on. So we met a long time ago, though, didn't we? And I didn't know that we'd met a long time ago.
We did. Yeah, we met when I was at the care home company and you came to do some training. And I saw you on LinkedIn. I was like, I recognise him. But it was all for positive. It was all good. It wasn't.
Well, I'd hope so.
It was good.
It must have stood out, which is a rarity because quite often going, I know you, but I don't know where from. But yeah, the fact that you remembered that I must have delivered training of some description is also quite a positive thing. But obviously you've kind of moved into a different realm. You've started your own kind of business, training business and consultancy business called Mindful Care. And you're obviously connected with Teepa Snow and one of the few in the country that offers that particular course. So how come you moved away from the kind of the management occupational side? Are you doing this now full time and what took you that direction?
Yeah, so it was actually during COVID. I've always wanted to go private, and especially since working with Teepa Snow and knowing that there were so many people, especially in the UK and worldwide, to be honest, that, loves Teepa Snow, loves her approach. And I just thought, I want to spread her word. I want to be able to train and train other people in her, her work and her training, really. And it was during COVID that I had twins during COVID and we had to move because of family support. And I just thought, let's give this a go. And it's been absolutely fantastic. We've within the last 3-4 years, there's a team. There's only 4 or 5 of us now, but with some freelance trainers, and we are able to reach people all throughout the UK and worldwide too. And this September, we're actually going to be doing some different time zones for people in Australia and America because we're getting so much interest from abroad. So yeah, that was kind of the reason that we went into it, and it's the best decision ever. And it's not clinical OT, but a lot of the stuff that we do is very much OT based. And the people that I work with are physiotherapists and nurses and speech and language therapists. So we're just a little team that's trying to reach out to as many people as possible at the minute.
Yeah, fantastic. Well, one of the reasons that I remember connecting with you and kind of messaging you directly saying, look, I'd love to have a conversation on my podcast and would you be willing to attend, is I think you were advertising a course which was looking at the Montessori approach for dementia care. And something I hadn't seen that before. That's something that kind of resonated. I've come across the Montessori approach for children and heard of it related to working in schools and things like that, but I've never heard it. And I thought, I know a little bit about it, but I'm going to plead mostly ignorance on this. As far as I know, it's kind of from within child sector, it's almost a kind of a free play approach. So it's allowing the children to guide their learning and guide their play. So I thought that makes perfect sense for somebody living with dementia. But I'd love to hear more about it. And yeah, so is that something that you came up with, or is that something that from elsewhere?
No, so it's elsewhere, and it's something that I'm really keen, and it's very occupational therapy kind of minded. And it was developed, and you're absolutely right. It's very similar, and it adapts the principles from the Montessori education theory, and it's developed by Dr. Maria Montessori. But it's about engaging individuals with really personalised care, but having a really supportive environment to allow people to be as independent as possible. And what we see a lot in care homes, and I'm not saying this is wrong at all, but what we see is, on a Monday to Sunday, we have activities planned. On a Monday morning, it's this, and a Tuesday morning, it's arts and crafts, which are great. But with the Montessori approach, it's very kind of more free. The environments are set up for people to be as independent as possible. And it's looking at what can activities provide you to maintain independence and abilities. A lot of the time in dementia, we kind of look at loss rather than what activities can we do to maintain those skills, to maintain those abilities, which is why it's very OT. A lot of OTs love the theory. So yeah, this is why we train it, and this is why we're trying to implement it a lot into care homes, and also people living at home too. So yeah, that's why we love it, and that's why we're trying to really get it out there.
Okay. So how do I know I'm not going to get you to give the whole course away or to give people, but how do you kind of get people to set it up? And is it just taking the stuff that I take it there's a lot of life history work that benefits to add into the Montessori approach as well?
That is, yeah. So you would do a really good thorough life history, and you continue to add to it as well. You'd be looking at the environments to see actually what are the environments, what are they visually telling you? What clues are you giving out? But what can I do here? What can we set up? And it's looking at that risk factor, which I think we talk about and we see an awful lot, risk, risk, risk. Let's take everything away from people. But actually, when you take things away from people, the risk of loneliness, the risk of reducing abilities, the risk of falls, et cetera, increases. But with the Montessori, if you're setting up environments to allow people to be as independent as possible and free, then, there's so many benefits. And there's a lot of research to say, how beneficial this approach is. And I guess one of the examples that I'll give as well is we had a lady in one of our care homes, and she was very, very keen on sewing, living with dementia, very, very keen on sewing, but had lost the abilities to really sew. And so what we did is we set up in the area of her care home. When she came out of her room, there was an area right in front of her so she could visually see it. And it was sorting out different buttons of different colours into different pots. And a lot of people think, well, that's not really meaningful. Like, what does that give? But for her, it was sensory. She was touching, she was feeling, it was familiar to her. And then within that, she was able to maintain those fine motor skills as well, which then helps with dressing, with eating. So it's not just about the activity, it's about what can that activity actually, help with other activities. So you're eating, your independence and ADLs, what does that activity do? Or, we might have a lady that is having difficulty dressing. And so actually, can we set up a dressing table where she's practicing getting dressed or dressing on another, on a model as such, dressing there, which then is transferable skills to be able to dress herself. So yes, there's a lot of activities which we might see, in care homes or at homes, but there's that deep kind of therapy part of it, of how can we maintain and keep people's independence? And maybe we might be able to increase the person's independence. So it's about not taking everything away from people and just letting people be. And then really evaluating that risk factor too, like what is a risk and what isn't a risk. So yeah, that's how you do it. Like we provide a 6-hour course on it, 2 half-day course on it, and after that you should be able to go away with loads of ideas to be able to set up a Montessori approach in a care home.
There's a couple of bits there that I think are really worthwhile kind of touching on a little bit more. One you mentioned there, the kind of the risk analysis, and there's quite a few different. Again, it's not just in elderly dementia care. I find it pretty much across the board that there is a significant risk aversity that sometimes. But what if they fall? But what if this? And what if that? And what if the other? And what if? And I get it across the board. But I think, as you rightly mentioned there, but what about all the risks of not doing it? Or the benefits to doing it as well. So, emotional engagement, all the if you're looking at the Kitwood flower, all the stuff at the top of it, as far as, the attachments, the occupation, the mental well-being that, again, we take for granted, but is so important to us on a day-to-day basis. People who have lost their legs, for instance, in an accident, they still learn to cope, but it's their mental resilience that makes a big difference whether they have a happy life or not. And people can see that quite simply, but I think there's something different when people move into care, or especially in the elderly. They maybe make that assumption that it's all about the physical decline. And I think that leads me on to the other part that I heard you mention there, that there's a focus purely on the decline rather than a retention and the upskilling. And it's kind of like there's an assumption they can't learn anything, or they can't. And now we understand more about cognitive neuroregenesis and stuff like that, and neuroplasticity, that, the brain finds amazing ways of continuing to do stuff if it's practiced, if it's worked.
Yeah, absolutely. And what you were saying there with regarding risk as well. I mean, I used to work in a hospital, and a lot of this is many years ago, but a lot of the time people would come into hospital and it was a crisis point of, oh my goodness me, we've been struggling. And now we've ended up in hospital and it's more of a social issue rather than kind of a medical issue. And then what we would find is a lot of time is in hospital, they would query Alzheimer's, query a type of dementia. And then it would be, oh my goodness me, let's take everything away from that person. And it's like, well, yesterday they weren't diagnosed with this dementia, this word dementia, but yet they were able to make a cup of tea. They were able to do this. So why, it's that kind of scare factor, they've got dementia now. So let's take everything away from people. And without that diagnosis or that word, they would still be able to do the things, but maybe with adaptations. So yeah, it's about, looking at what is a risk and what isn't a risk. And actually, okay, maybe this person isn't able to make a cup of tea. It's very OT, isn't it? Cup of tea. I need a new example. But actually, how can we adapt it? Yeah, let's not take everything away, but how can we adapt this task and break it down so people are able to do it? But I think people are very scared and they take everything away. And like you were saying, it's what are the benefits of keeping to do this? Strength, mobility, fine motor skills, just cognitively, there's so many things that people need to maintain. Otherwise, if we take those things away, people get poorly very, very quickly. And you just think, well, what happens if I was in that situation? I wouldn't want everything taken away from me. And then and then I'm going to digress, because then we call people aggressive and blah, blah, blah. And that's another thing altogether.
There's an example that I've seen before related to the cup of tea one. And I think there's not just a moral reason as far as promoting people's independence and giving them the best quality of life. I think it is also worth kind of considering for organizations that there's a legal reason as well. Mental capacity is they should be able to do the things they've always wanted to do. You need to have best interest decision to stop them from doing that. It shouldn't just be immediately, well, let's take that away just in case. It should be, I better have really good justification legally for taking that away if that's something they enjoy and something they want to doing. So I think there isn't just, morally, we kind of think, well, of course we want to promote people's independence. And of course we want them to have good mental well-being and improve their outcomes and have the best quality of life at the end of years. But I think it's always worth going, hey, it isn't just moral. There's financial and legal reasons for this as well. So please, this is serious for any care organization to kind of consider.
Yeah, 100%.
Have you, so I take it have you had feedback from people? You said it's been evidenced as far as the Montessori approach for dementia is concerned, but have you had some anecdotal evidence from people that you've supported and taught this, that, the improvements that it's made?
Yeah, so we've had obviously there's a lot of research out there that I haven't gone and done, but the people that we have trained and supported to implement this, it's very much individual things of, Mrs. Smith, I don't know why I always use Smith doing Mrs. Smith is now coming out of her room and she is really interested and engaged in a particular activity. And we've had one lady that's now making hot drinks and teas and coffees for all her other, all the other residents and other people that she's living with. And I think it's not just about opening, sounds an awful thing, but opening minds about what can people do? Like, what roles can people do? What roles did they have before? And why are they taken away when they come into a care home? Like, we're all one big family here and we should be working as a family together. So we've had a lot of positive about individuals, and we've had a lot of lovely pictures sent to us about the environments. And, I've said to them, your environments will change depending on the people that you're supporting. So what we don't want is that we go into a care home and then actually, oh yeah, this environment was set up 2 years ago for such and such who's no longer here. We'll change it. If it's not working, change it. But we've had a lot of the managers have come back and said that the staff going away really enthusiastic about activities. And it's not just about the activity assistants doing something, it's a whole home approach, including, the catering team, the domestics team, everybody can get involved in the Montessori approach to dementia care, which I think is really, really important and it needs to happen.
One of my fundamental things that we do with my training company is we tend to focus. Sometimes it's not the skills, it's a mindset that's so important that sometimes these things are thought about, they're known, they're aware in the ether, but it's trying to connect with the people who are doing it to kind of really help them to realize that they'd be doing their job better by doing these things. Because I think there's many people who come into care, and I think because they genuinely care, they want to nurture, they want to help, they want to support. And I think sometimes there's that control, but you wouldn't do that with a child in so much as, you'd encourage a child to tie their own shoelaces. You just wouldn't keep doing it for them because you think it's a development rather than a decline. Whereas I think there's an instinct sometimes from caregivers going, no, okay, you sit there, I'll do it for you. And they're generally trying to be nice. They're generally trying to be kind. They're not coming from a bad place in the slightest. They think I'm paid to help you and therefore I should do it for you. And I don't think there is that whole cultural and mindset shift, isn't it? They're going, yeah, but you're taking something away, even though you think you're giving that one cup of tea that you give them that they could have actually got themselves. You think it's a nice thing, but actually you've made it, their likelihood of being able to make tea for themselves ever again, less. And I think that's a difficult thing to try and, I found it definitely difficult to make people habitual. They get it to start off with, but get it ingrained within the culture. Have you found that yourself as well?
Yeah. And, and I don't know whether you find this as well with some of the training. And I know the training that I've been on before, not yours at all, but the training that I've been on before in dementia care, many, many years ago, you would go away really enthused and then it would kind of fizzle out. Because actually you really want to do this, but you're met with so many barriers. And one of the barriers is, we've done it this way for so many years, there's nothing wrong with it, so why are we going to change it? And it's like, we know more about dementia now than we did 5 years ago. So we need to adapt as much as we know more about dementia or any other condition as well. And I think a lot of the time it comes from management and maybe the ethos, even things from marketing, from the company. It's the whole way that we sell what is care.
Yeah, the whole concept of care, you've got this idea of kind of, it's I suppose it's very still connected to your kind of NHS, that this person is poorly and we are here to, it's still a medical model, I suppose, isn't it? That's still ingrained within systems to some degree. And it's shifting over to that. Rather than just thinking as you said, what they can't do, it's how can we adapt the environment and how can we adjust what we do to promote and encourage what we do. And that's still relatively new as far as shifting over to that social model or the medical model. Whether it be mental health, whether it be dementia, whether it be learning disabilities, physical disabilities, whatever it is, we're still fighting that concept of, yeah, but you are lesser than the norm and therefore you have to adapt, or we just have to kind of limit and restrict to make you better, rather than going, oh no, you are just who you are and we need to make these reasonable adjustments to promote that quality of life and that mental health and everything. I think that's probably, to Sorry for putting words in your mouth, but I thought
Yeah,
that's where you were
no,
going as far as.
fine. Yeah. And yeah, absolutely. But when you were saying beforehand, it is that mindset. And it's the mindset of the whole team. It's not just
Yeah.
the mindset of a few people. And it has to be a culture thing. It has to be change of culture. And it's not being afraid. We were talking about risk. And actually, I think this kind of comes into it a little bit. It's not being afraid to try something new. And, we're not saying go and do something that's crazy. This isn't something that's new and let's just try it. And there's loads of risks associated to this. This is just everyday happenings. This is how we would want to be treated. And like I said, that legal aspect of it as well. And but it does come from the top, and it does come from, maybe not even the managers, but it comes from the company and the directors from there. And how do we look at what is care? But yeah, I mean, the way that we've tried to do this is we've created pledges. So from our training, they go away and everybody has a pledge, and then that feeds into their PDR and their, and the home has a pledge as well. And it's looking at how can we, once people have done their part of the pledge, and then they feed into the home's pledge basically, and looking at evidence, photographic evidence, reflections, etc. And then once that pledge has been done, what's the next step and what's the next step? But again, you need the managers and you need the leadership to be really on board with this.
Yeah.
Which is sometimes the most difficult thing, I find anyway.
I think, yeah, and maybe we should deflect that it isn't necessarily just a cultural within the organization itself. I think that's massively important. And yeah, it is the powers that be. It's the money that drips down and the very company ethos. And I'm sure, like yourself, I've visited some amazing homes and some amazing care organizations that are so proactive about this kind of stuff. I went to one recently, and they had a sensory room, for example. But it was the first time I've ever seen a sensory room that was set up, ready to go. The smells were wafting down the corridor. The TV and the projector were on. The bubble machine was on. Most care homes that I go to that got a sensory room, it's kind of room put in, everything's turned off, everything's kind of put away. It's often about 7 wheelchairs and frames in there because it's just now used as a bit of a storage space. And nobody's utilizing it. And straight away, I'm like, you don't know what you're missing out on as far as you would reduce so much distress behavior. And this organization I was with, they find the individuals who live here, they find the sensory room themselves because they follow the smells. And then suddenly you just find one in here kind of playing with the stuff on the wall and engaging with it because they're promoted to be independent and engaged. So there is those homes out there. But I think they fighting against the system, fighting against the norm a little bit, and definitely with, obviously there's some controversy at the moment around CQC and things like that there's so much pressure and bureaucracy for care homes that if they mess up, suddenly rating going down, you're not doing your paperwork correctly. We don't care what level of care you're providing. It's more about how you're filling your paperwork in. Yeah, and your records need to be right, even though you haven't filled in your records because your staff are too busy actually engaging with people. And it just, I think so it isn't just the home, is it? There's a whole culture around the way that care is promoted, managed, recognized. And I think you said it beautifully there as far as, people do have that different perception of care. It needs to be this whole systemic change of mindset towards the concept of care itself.
Yeah, absolutely. And what is care? And, and like you were saying beforehand, okay, I'm here to be paid to help you, but what does that help look like? So yeah, absolutely. I've, like you said, you've been to Fantastic Home. I've been to Fantastic Home. I train at one particular home they're amazing. And the manager gets it. The manager really gets it. But she is coming up against like those other things that she can't really control. But her team and her are doing the best possible job that they can do. And the people that they're caring for are so happy. But they obviously don't see the stress that, the managers and everyone else are facing, kind of bumping heads with the system as well.
Yeah, absolutely. And I think that's what I sometimes get frustrated. I'm sure you do as well. So for training for me is massively important within organizations. I think it can make a difference to, unless it's hard for a manager to get their message out there. If there are, again, like you said, some amazing managers that really have it in their head, I sometimes find that the managers don't go on the training. That's always a worrying and a bit of a red flag for me. They get all the staff to go on it. And I know and I'm sure you've encountered that at times. I like your pledge and policy thing that, I do it a lot in behavior stuff. And this isn't just elderly care. This is across the board. I teach stuff around, this is how we should be approaching behavior. This is how managers are asking questions about whatever. And they're so enthused. They're so like, yes, yeah, this works. I completely get it. But I know as soon as they walk out, they're going to be going, no, that's not what we do. No, yeah, he doesn't understand. And because the manager hasn't been in there experiencing the same thing, it hasn't been going through and having their mindset shifted if they're willing. So that's a real challenge. So do you overcome that through doing that pledge? Is that something that you connect at the top levels to kind of go, if I'm training for you, this is what you have to do?
Yeah. So it won't be all of our courses, but like for the Montessori course, it especially is that people need to go away and make a pledge. And you make a pledge at the end of the training. And then I write that down and then I follow that up. But again, trying to get managers on 9 times out of 10, because if we're training a particular home, for instance, I'll try and meet with the manager to start with and say, what are your expectations? And also what are our expectations as well? We need to come and work as a team together. And I think sometimes it doesn't go down too well because it's like, well, I'm paying you to train my staff. I'm like, I know, but I'm not going to come if it's not going to work. There's no point me, spending time with your staff if actually it's not going to improve practice. So yeah, I meet with the managers an awful lot and tell them what my expectations are, too. And then it's the whole pledge side of things. And some of our courses, not the Montessori ones, but some of our courses, we then have management calls every 3, 6, 9 months to continue with this kind of pledge and action plan. But it's only as good as how they're going to implement it and how much support they have. And we can do as much as possible. But I mean, we have had some really good stuff come out of this and having a pledge rather than just going into training going, that was good, and then walking out. It's that follow up and then putting it into their PDRs and to their reflections, to their CPD, et cetera. And that's the way that we're trying to do it at the minute. And if there's any more ideas that you have, let us know.
It is. I find it difficult. I always say when I'm doing like trainer stuff and I'm teaching in-house trainers, I always say, well, in-house trainers, you have a unique opportunity. You can be on the floor ensuring that everybody's applying this daily and engaging with it and stuff like that. So, follow it up. For external trainers, it's sometimes quite difficult, but I think there's then different challenges. I sometimes find with internal trainers, again, if the manager isn't on board with it, well, I know you've done that trainer course, but can you go do it I know it's meant to be 3 hours, can you fit it in half an hour? And, and so they're then batting against another difficulty. So again, it's all from the top and it's all that whole mindset shift. And I think what you stated there, it's if you want the value out of the training, then you need to engage in the training fully. Otherwise, you're just paying to tick a box.
Yeah.
And I don't know about yourself. We have, from a marketing strategy, we have our avatar and our anti-avatar. And our avatar is who we really want as a customer. And we've got a description of where they go, what they do. The anti-avatar is who we don't want. The customer that is and we've named them called box ticking Barry. So box ticking Barry is the customer we do not want. So when they're calling up going, yeah, but can we get it cheaper? And can we do it like for 70 staff, one trainer? And then we're like, no, bye, you're box ticking Barry. We're not interested.
I'm going to have to come up with something too, I think.
But you've encountered them, you're right. You just got the ones that it's all about the price. We just need to tick a box to show that we're willing. But we're not willing. We're just we're willing to chuck a couple of staff in a room for a day and pay a bit of money, and that's just that's not. I know that's definitely not what took you down the journey into being a trainer, and it's definitely not what took me down into that route to being a training. Yeah. No. So the other course that I know you have a real passion around that you mentioned and you've come across on your website is a cognitive stimulation therapy. So this is where I kind of, I don't know much about. I understand all those 3 words separately. So So I know what cognition is, or cognition is. I know what stimulation is. I know what training is. So I can kind of make an assumption of what it is as far as its mental stimulation. But tell us, what is it you do? Because I know that it's something that you're quite passionate about.
Yeah, so cognitive stimulation therapy, it's been around for quite a while, but not a lot of people know about it, which is crazy, considering it's in the NICE guidelines of saying once someone's been diagnosed with a dementia, they should have access to CST, which is cognitive stimulation therapy. But we do, so this is one of our most popular courses, and we do this throughout the world. Like we've had groups in Australia be set up from our 3-hour course, which has been amazing. But yeah, it's a type of therapy specifically designed for people with mild to moderate dementia. And I would say that's what the research is about. But we have had people come in that are a little bit maybe later stages of dementia, and we've had benefits there, maybe different benefits, but we've had a lot of benefits there too. And it can be as a group or it can be as a one-to-one. And the NICE guidelines, like I said, they really recommend it. And there's research to say that CST can be as beneficial as early medication for people living with dementia. And why are we not having access to CST? It's such a postcode lottery out there with CST, and how many sessions do you get? And you should have up to 14. There 14 different therapy sessions, and normally over 2 times a week. So people can access these in the community. We set these up in care homes as well. And when we go to care homes, a lot of people are saying, but we do cognitive, therapy. We do cognitive games. We do puzzles and we do quizzes. But that, yes, it's part of it, but that's not what CST is. CST is a structured, a semi-structured therapy group. Like I said, it's over 14 different sessions, 2 times a week. And they're about an hour long, 45 minutes to an hour long. And they're all different themes. So one week it might be physical games. The next one would be like sound, childhood. There's one in there about food, current affairs, faces and scenes. What other things are there? Word associations, categorizing objects too. So you would theme that session around that theme. So for instance, say like using money, that's another theme. So using money, so you might have an activity in there about, making a shopping list, and you've been given £20 and what could you buy? And in front of you, you have you might have some visuals. So you might have, some tins, or you might have some cereal packets, some milk, etc., etc. And you might have had put some, how much they are. And then you would look at a shopping list and say, well, what could you buy for £20? And then what meals could you make out of it? Okay. So it's all about challenging the mind. So again, it's not about let's just give someone an activity just to be kind of happy and, to enjoy it. It's trying to really engage in the brain to stimulate those neurons, get those firing. And it is around that neuroplasticity too, is actually, yes, okay, someone might have some damage in the part of their brain and they're having difficulties, but can we give them CST and their brains can be firing? And actually, can we make new pathways in their brain to be able to continue to, do what they were doing beforehand, for instance? So it is very different to just an activity group. And like you can do a one-to-one as well, which isn't as long. It's not an hour session. I think it's about half an hour-ish. But again, really good for people that maybe are living in a care home and do not want to come into a group activity, or people, training family members at home to do with their loved ones at home as well. And it's their group. So for instance, in a group CST, they would come up with a group name. They would come up with a group song, and it'd always be kind of repeated. Every time you do the session, you would repeat it. So people would know, okay, today is CST, and this is the song that we start with, and we're going to be singing the same song at the very end. So we know that they open and close. And then we have the main activities in the middle. And then also they can help, because it is their group, they can help plan for the next one. And so it's 14 sessions, but then after that, you can have a maintenance CST. So you've done all this amazing, great work. And then what you don't want to go is like, well, that was lovely. Off you go. And actually, if you have that maintenance CST, it's continually to tap into the cognition and tap into that neuroplasticity to maintain independence as long as possible.
Yeah.
And this is why I love CST, and I sing about it and talk about it and shout about it all the time, because I don't know why it's not used as much. And we should be offering CST. It should be one of the first things that we go to rather than going, well, here's some medication.
Yeah.
Sometimes medication doesn't work for some people. And can you imagine the benefits of medication and CST together? Yeah. But yeah, something, and it's, it's not expensive. It's a 3-hour course that you can come on.
Yeah.
And, the books are out there to help you set one up. I love CST, and I really want people to know more about it and to try and set them up in the communities or wherever.
So it seems to me that it should be set up as mandatory. It feels like every care home should have the capacity to be doing this, running this, and so yes. So for me, that should be just a given. Like anybody who's doing activities, all care staff should be doing this. But I also feel like, wouldn't it be absolutely fantastic for all family members to actually have this? And the instinct is probably for those people who are still living at home to have, but so often I find that when family members go and visit their loved one living with dementia, they don't know how to engage with them. They don't know how to talk to them. They don't know how to connect with them. So they end up kind of getting annoyed because they call them the wrong way anymore. They can't remember, they're repeating things over and over again. So then they stop visiting as much. And obviously, or it's frustrating, or they get irritated with them, which is never going to be positive for the person living with the condition. So actually, if family members were kind of to encourage to be part and parcel, like the maintenance side of things, well, families should be doing the maintenance side of things. It'd be amazing to do, wouldn't it? Going, hey, why don't you do this activity with your mum today or your dad today? Because they need their CST kind of maintenance thing. And it's just something to actually do. I think I find it frustrating that some homes don't do more to help families to stay connected with their loved one. Because again, it's that, but I suppose it's that reviewing of what care is. But if it's all about but that should be, as you said, we should have medication, yes, but we should have CST, but we should also have family engagement, should be up there with medication. It should be just a case, these are the treatments we offer to this person to improve their quality of life and try and slow down the progression of that illness and stuff as much as we possibly can. Thank you for listening to the Able to Care podcast. If you're enjoying this episode, please like, comment, and share. We really appreciate all of you listeners. So the other thing I wanted to chat to you about, well, there's two things I'd like to talk to you about. One is maybe more of a personal thing, which is the Mombasa, Kenya thing that I mentioned at the beginning of the introduction there. So was that doing OT work over in Mombasa in Kenya then? Oh,
yeah.
amazing.
So it was myself and who's actually my colleague, physiotherapist who works does a lot of freelance training for us at Mindful Care. We went over there. This was, oh my goodness, a year after I qualified, so a long time ago. And we went over there to work as OTs and physiotherapists, and we worked in a cerebral palsy school. Well, actually, we did a few things. One of the things was a cerebral palsy school, and that was, oh my word. You know when some people say you go over to, you have different experiences and it really changes you? That was it. And a lot of we were, the only kind of English people going over there. Their culture is obviously very different. The most beautiful people in the world. But the training of OTs and physio is very, very different. In fact, there was one OT there who trained in London, and she'd moved back. And so we were trying to really help her implement an awful lot of things. But for instance, there was, because the training that the people had specifically in this school wasn't as great as maybe we would get here. There was a little boy who, with children, it'd go from like rolling, sitting up, that sitting balance, that core strength, to be standing, then walking.
Yeah.
But actually, these children didn't have core strength. They weren't able to have sitting balance. And so they were tying them to in the kindest way possible.
Okay.
They weren't doing this to be nasty. They were doing it in the way that they knew. And this was many, many years ago. So things
Yeah.
hopefully have changed. And kind of tying them to this sounds awful, like ladders to try and keep their strength up. And they would stay there for like 20 minutes, 20 minutes, 30 minutes to try and maintain
Wow.
their strength. And, the equipment that they had out there was not obviously the equipment that we see here. So, one little girl was strapped into a very large wheelchair. And she was kind of tied into it. But because the wheelchair was so big, then obviously we couldn't get her out of the doors or anything like that.
Right.
It was a very bizarre. It was a phenomenal experience. Don't get me wrong, and the people there were incredible. And when you come back and you see that people are complaining about the NHS sometimes, my goodness me, how lucky we are to have the NHS and this health. And there's things wrong with it. Don't get me wrong; it could be so much better.
Yeah.
But yeah, very, very. It opens your eyes, and especially as a young therapist going over there. And it wasn't just the therapy; it was the language barrier as well. We didn't speak Swahili, so actually we had to learn language, and then we had to make sure that people came on board with us. Who are you two from England coming over here and telling us what to do? And so we had to kind of pick and choose what we could really try and implement. So that was kind of one area of it. And then the other area was working with, they call them street children, which I'm sure there's a better name. But it was for a lot of orphans that are on the streets from age, 2, 3 up to teenage. And it was trying to get them to try and make friends with them really. And try to get them to a place where we could then educate and keep them safe. But there's a lot of gangs over in, or there was a lot over in Mombasa at the time. Very scary at nighttime, especially if you're 3, 4, 5 years old and seeing them sitting there sniffing glue as well to keep warm. It's very, very heartbreaking. And again, you had to kind of, I think I was like 22 when I went over there. And to see that and to try and be part of that, to try and help people. But one real good success story is that one of the other girls that was over there helping with that project, her family actually helped sponsor this child, and he's gone through university, and he was on the street, but now we got him to education, fund him through university, and now he is a manager over. I don't think he's in Kenya anymore, but he's still in Africa. But yeah, came off the street for that. But it's heartbreaking because you would do this lovely work with people and you know that they want to do it, but it's just the gang culture. But yeah, it's a massive, massive eye opener. And yeah, I did actually write an article in it. I'll have to try and find it about the equipment side, especially from an OT point of view, and looking at wheelchairs. And this was the other thing as well, is that, which was really hard to kind of come to terms with and not kind of try and step in as a person that is not from their culture and doesn't live there, is that if a child was to fall down, so there was a child that was in splints and was trying to help this child walk, and they were saying, come on this way. And if the child was to fall down, they would get the cane and they would hit the child as a punishment. And that is heartbreaking to see, because that there's a much better way to do that, but to be able to tiptoe around it and try and keep that child safe. But it's
well, to maintain rapport, so you're not just being kicked out the building because you're
exactly yeah. And there is a lot of like, well, why were you here? What are you doing? Like, we're fine. But I mean, that was many, many years ago, and hopefully, things have improved. But the most amazing people, they weren't doing it from a bad place at all. The most amazing people. It's just what they were used to and their
culture, like we spoke about. Yeah, absolutely. Yeah, that's it. It never denotes the person. I do a lot of stuff around, obviously, the even with the safeguarding and abuse cases is sometimes it's not about the individual person, it's about the culture, and it's about education, it's about changing mindset, as we've already spoken about. What an incredibly humbling experience to come fairly fresh out of uni. How long were you there for? Was it a few months, did you say?
6 months.
6 months. That's a quite a long time to be over there and immersed in that culture as well. I do think there is, this is where I'm going to sound like an old man probably, but there are so many people coming out of university that I genuinely feel should go and have such a humbling experience so they can actually put perspective on the lives that they actually have and the things that should and shouldn't be a problem to them. I sent my son went on, it's called World Activity. I can't remember what it's called now, but when he was at school, the last couple of years, he went off just for a couple of weeks. But he went to Thailand, and it was a week of, they had to kind of fend for themselves. They had to be independent and organize their own meals and hotels and travel to get around in the first week. The second week, they then went and did some volunteer work at repainting a school and stuff. And he came back humbled just from those 2 weeks, kind of going, seeing the poverty, see the difference in lifestyle has made me appreciate everything. And I think it should be mandatory. That's why it's annoying that kids don't get to be taken out of school on holidays other than, because that's it. Travel can, be an incredibly powerful activity as well, can't it? That, unless it's an all-inclusive in Spain sort of thing. Yeah. But there's educational, humbling kind of things. Yeah, so some voluntary work, they could do that, and then parents could get them out earlier. You're allowed 2 weeks off, 1 week of volunteering, 1 week of not. That'd be good. So obviously, you working with children with cerebral palsy at that point, so you were in the more child sector at that point. So what took you over into the dementia side of things then? Was there something that happened? Was there something you just saw?
To be honest, that was really my only paediatric, apart from placements and things like that when I was training, that was my only kind of paediatric work that I've done since I qualified. It's always been older people. I started off in brain injury and traumatic brain injury. Yeah. And anything to do with the brain and cognition just fascinates me. And dementia is just something that I find fascinating. And because we don't know everything about dementia now, I think that's what's more fascinating about it. And because there's so many people living with dementia and care partners having to, looking after their loved ones, there's so much support that's needed. And I kind of feel that if we can provide some support to help people, even if it's like the littlest things, or even being a soundboard for someone just to go, rah, like for half an hour to feel better, we're here. That's what if we can help in any way, then we will. And that's kind of why we've stayed with dementia care and bits and pieces, because there's so much support that's needed out there. And we learn new things all the time. So hopefully we can help with that.
I was listening to some the other day that actually there's some studies showing that definitely certain forms of Alzheimer's might actually start developing way, way earlier than we originally thought, that it might be a kind of a middle-aged kind of thing that it starts to develop, but we don't see the symptoms till much later. So I didn't do a lot of reading on it. I haven't kind of read whether there's actual articles and stuff. I'm not sure whether you, obviously, if you have, then by all means let me know. But there's so much more work, again, rather than just medication, when we start to see trying to move over into that preventative mentality. And the things like the cognitive stimulation therapy, it's huge. Even just in earlier life, don't wait until they get the diagnosis. Should more people be, exercising their brain and having activities that can do that? But I suppose people will. This would be interesting to ask you, actually, the brain training apps and stuff like that, because I have heard that they do not benefit and they do not help in the slightest, as far as. But what's your take on those?
I don't think there's any real research that's solid. I don't know. There might be, to say that they really help. But what I would say is they can't do any harm. But it was funny, actually. This was many, 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 many years ago. And I'm kind of going off a little bit, but it is related to this, I promise. Is that I went out to go and offer some Dementia Friends sessions years and years ago to a very wealthy place I'm in Suffolk, a very wealthy place in Suffolk, not where I live in Suffolk, but and it was actually at and this isn't anything to do with people that play golf in the slightest, but it was a very expensive golf club. And I said, we can come and find. Oh no, darling, we've got lawyers here, we've got doctors here. We don't have dementia. And it was that perception of like, oh, okay, because you think that actually you've maybe stimulated your mind and you're of a higher education level, that dementia doesn't affect you, then that's quite worrying. I did have to bite my lip and not be like, so yeah, but I don't think there's any harm. But yeah, I think the jury's still out on that one. I don't think there's any hard evidence. I think the main things is literally, exercise, keeping fit and healthy, all those things that we recommend for kind of, especially like vascular dementia, things for like heart attacks and strokes and, all those vascular events, like keep healthy is probably the best thing. And throw in some mind games as well if you can, just to see.
Well, my dad does his Sudoku, so that's I don't know whether that's enough, but he'll say it is. But yeah, I think it is as far as prevention. We don't know 100% or everything about dementia, the causes, and there's multiple things. And people who have had very, very healthy lives can still develop dementia, but it's the same as, it's a bit like smoking, isn't it? Kind of going, we know that people still get lung cancer even when they don't smoke, but we also know that smoking increases the chances of lung cancer. So therefore, if we're looking to decrease the chances of anything, then living a healthy life, it increases the likelihood of that. So yeah, the last thing I just wanted to chat with you is obviously you have trained with Teepa Snow, and yeah, I know that two of my colleagues went to see her recently over in Wales, and so they did get to, and we're desperately wanting to try and get it connected. And it is one of my plans to try and get her on my podcast at some point as well. So.
Can you invite me along as well? I'll just be there.
Yeah, you can sit in. Yeah, but it would be amazing to get her on. But obviously, where she's at the minute, that's a hard thing to kind of do. I'm building up to it. We've got some amazing guests coming on soon that hopefully will take me in that direction. So, but yeah. So, where did you come across Teepa, and how do you find implementing a system? Because I find it strange. Some people really know her. And then there's certain environments where I never heard of her. And like, how have you, if you work in dementia care, how have you never heard of this lady?
Yeah, so definitely. So when I was working at the care home company, there was an opportunity to, I think Teepa was coming to London for the first time. And the training manager at the time was like, oh, have you seen that this lady's coming? And to be honest, I knew a little bit about her, but this was years ago, but I didn't know loads about her. And then I looked at the gems and I was like, wow, this is amazing. So I went down and I trained with her in London. So it was the first time that she came over to the UK. And I didn't think Teepa was going to be there, if I'm honest. I thought it just might be in her team. And I remember being late from London, Liverpool Street, literally like running all the way to get to this place, probably getting lost, know what I'm like. And then coming through the door and she was just there. She's like, oh, hi, Kate. I was like, oh, hello. And then, it was amazing. And I'm quite, I don't know if you've seen a lot of YouTube or if people have seen a lot of her on YouTube. But if you go on there, you'll be stuck in there for hours because she's so incredible. But they were filming the whole session. And I remember I think there was about 15 of us, I think. Yeah, so it was 15 of us in that session being trained by Teepa and her team and her daughter, and who's really part of the PAC team now. And everyone had a partner, but because it was an odd number, Billy No Mates here had nobody. Right. So I was partnered up with Teepa. Because it was being filmed, I was thinking, oh my days, I'm going to end up on YouTube.
Yeah.
But I haven't. So I'm quite pleased. I kept looking for this, thinking that I'm going to be the one that's, on YouTube, but I wasn't, thankfully. But she was incredible. And I was actually able to ask her, I'm working in a care home a care company with 37 care homes as the only dementia lead. And at that time, I didn't have the coaches. I didn't have a team. It was literally just myself. And she was like, that's never going to work. And then gave me tips and advices about what I could do. And she spent so much time with on a one-to-one basis of trying to support you to support others.
Yeah.
And then every year you train with her team. And honestly, I can't speak highly enough of her team as well. They're incredible. They are based in America, but yeah, you do a lot of coaching with them, and they're just amazing. And it was when I did the training with Teepa, it was that realization of, oh my goodness me, what more could I have done for the people that I've cared beforehand? And I think maybe everyone feels like that once they know more and they're trained in it. You think of people
massively.
and think, oh God, I didn't do that right, or I could have helped in a better situation. So yeah, and it just really enlightened me, and it just made me so excited to go and spread her word. And I have to say, the Teepa Snow training that we provide to people and to family members as well has been the most well received. And it's almost a bit like a light bulb going off, going, okay, yeah. And it's simple stuff, it's like hand under hand, for instance, is really simple stuff, but it makes sense, and it's common sense once you know it. But if you don't know it, you don't really think about it.
Yeah.
But she's incredible.
Yeah.
So I would really recommend everyone kind of having a bit of a search on who Teepa Snow is.
Yes.
And looking into her.
I find her knowledge incredible, but I also find her inspirational from a trainer's point of view as well. I think the way that she hits, visual, auditory, and kinesthetic learners, and the way that she gets people doing stuff, I think is fantastic. I also just love. I like to act a little bit as well. I like to perform when I'm training, and she's inspirational out front. And the fact that she plays or acts like somebody with dementia, and she's just so good at it. It just brings it to life, which means you're almost doing scenario training every time that she teaches. And that's, I've definitely always found that quite inspirational as well from both sides. So yeah, amazing.
Yeah,
I'm hoping to learn with her at some point. She's on my list.
I don't. She's just been over, hasn't she? I know they do a lot of the online training. I don't know if she's got another date to do. She might be coming back next year. I don't know.
Well, soon she'll want to be on the Able to Care podcast. She'll probably want to come into the studio because she's heard about this amazing host. So, and then over in America, they're all about Andy Baker. And
heard of Andy Baker?
Yeah, have you seen some of his stuff on YouTube? It's amazing. One day they'll be talking about both of us.
I'll drop her a line. FYI.
Just say, I've met him.
Exactly. I didn't think it would be him. I thought it'd be his team, but it was him.
You're so lucky, Kate. You're so lucky.
I know, right?
Well, thank you so much for joining me today, Kate, and really appreciate it. It was great having a conversation. So yeah, thank you. It was
great.
Much.
Thank you, Andy. Really appreciate it.
So for those of you who are listening or watching, if you've enjoyed today's session, obviously we will be including details of how to find Kate and her company, Mindful Care Training and Consultancy. We'll include the website in the show notes. She's also on LinkedIn and some social media as well, so do reach out. But if you have found this episode interesting or useful, then please like, comment, and share to other people to pass on this information. Please spread the word a little bit about cognitive stimulation therapy as well, and let's see if we can get more homes and people engaging in that to improve the quality of life with people living with dementia. But otherwise, thank you very much for watching and listening.